Alright. So the types of different dental equipment that people see at an office tends to consist of these instruments in particular. So I'm just going to go over, this is called an Explorer. Okay, it has a sharp tip and it has a tip that measures. So our gums in general, we tend to think that they're directly attached to our teeth. They are when we get a little bit lower down. But there is a little bit of space between the loose gum and the tooth right near the base of the tooth. And so what dentists can do is actually use the tip here to measure that gum and see whether or not you have periodontal disease. Now, when you get experienced enough, you can basically look at an x-ray and tell whether or not someone has periodontal disease, or you can take a look behind their teeth and see if they have plaque buildup in that area. And that will determine pretty easily whether or not they have inflammation. So this is called an Explorer. So the dental mirror in general is something that's super important because dentists need to have a really good conception of 3D space. That's actually one of the main components of our exams before we enter into dental school, is we need to make sure that we understand generally how to look at a space in 3 dimensions. The other thing is we need to learn how to work with a mirror. We need to learn how to do a surgery essentially through a mirror. So a lot of the time, dentists, in order to not destroy their necks and their backs, will be using this in order to see those small spaces inside of our mouth and genuinely to do procedures as well. The annoying part is oftentimes there's water that gets onto the mirror, and so you have to kind of look through a shady surface to figure out what's going on. So a lot of dentistry also becomes tactile. Tactile meaning that you feel a cavity with the squishiness of a tooth or the way that a burr interacts with it more often than actually being able to see it all the time. So mirrors, a big part of the subconscious, the other soft skills that a dentist needs to have. This is called a forceps. And so forceps are used to genuinely control little movements and little things to pick up. So when our hands are dirty and covered in saliva or blood or something, we use forceps to pick up other instruments, little burrs or cotton, whatever it is, inside the mouth. Obviously, I have slightly larger hands. I'm also a fairly tall dentist, and it doesn't make my life much easier. But at the end of the day, when I have tools like this, instruments like this, it really does help in terms of reaching places. This is the dreaded syringe. This is what most people are incredibly afraid of. When they come to the dentist, I always tell them, listen, we put on topical anesthetic, you're gonna feel a little sting, sure, but you know, at the end of the day, we're trying to take care of your teeth, and we gotta do what we gotta do in order to make that happen. So we try to make it a calm process. We try to get it over with, and the velocity with which we inject is definitely correlated to the amount of pain that someone's going to feel. So if a dentist just goes in there and just sticks it in, you know that they probably don't care that much about how you feel. So careful with that. In general though, the syringe is made up of, and I'll actually open this. The syringe is made up of multiple components here. So this is where carpule anesthetic will go into the chamber. It's kind of like a gun. And then this squeezes, and at the end here is a screwable tip for the actual needle part itself. All these components kind of wiggle a little bit, but it's metal, and that's the syringe. This is the scariest part of dentistry. We use this literally every single day. If we didn't have this, you'd be in a lot more pain doing the procedures. So you can thank modern science for coming up with this thing. This is a high-speed handpiece. Okay, so a high-speed handpiece is what most dentists will use to start drilling out cavities, and it is something that, generally speaking, works really fast. There's also these little holes inside of it. I don't know if you can see that, but it basically squirts water on the actual drill bit itself and makes it so that your teeth don't have trauma because of thermal issues, right? So the burr is going to spin really fast. Those of you that work in construction know that water is required to make sure that the entire system is nice and cool. So these basically are things that we sterilize, and then they go onto these things called a coupler, which is attached to a bunch of pipe here. And the pipe basically has water and air in it. So you put this on here, okay. And then right down here, I'll show you, is a thing called a rheostat. So this actually turns on the handpiece. right? And it's actually, so to some degree, dentists not only work with their left and right hand, but they also work with their feet, which is a little known fact about dentistry. It's I'm a drummer, and I've been a drummer for a long time, and I can use both my feet to use the rheostat. The cool part is the more you step on it, the faster it goes. So there's actually a little bit of nuance to what speed you want to go as well. So that's all taught in dental school. It takes people years and years to get it to the point where they can actually do a filling efficiently, which is why dentistry costs a lot of money, by the way. It's kind of a skilled thing. But yeah, so basically this is a high-speed handpiece. This is a slow-speed handpiece. So these guys here are used with slightly thicker burrs. They have a little latch in them, and you put them onto this thing. And again, very similar. So we'll sterilize this at this part. We'll clean up this with Lysol wipes and stuff, and we'll make sure that a low-speed handpiece is only really useful for when people have cavities. And the reason is because cavities in general tend to demineralize the tooth structure. So when bacteria go in there and they start eating away and they start putting out acid, the structure inside of the tooth actually becomes really soft and mushy. And so what this helps us determine is, okay, fine, if something is white at the base of a cavity and there's no indication besides tactile feel whether or not there's more bacteria there, then the slow speed burr will actually go in there, not remove the actual tooth structure that's healthy, but remove the demineralized tooth structure. So it's a really good way for us to keep track of what it is that is cavity and what it is that isn't cavity inside of teeth. Now, the Explorer also helps with this. The sharp end of the Explorer is used to literally explore. And if we go in and we feel something sticky, very good chance that that's a cavity. We'll get rid of that, fill it up for you, and you'll be in a good state. So those are the basic instruments that are used in fillings in particular, in most dental procedures that you'll be seeing. We also have this ultrasonic scaler here. Now this thing usually has a tip that goes on here. It looks kind of like a hook and it looks really scary, but basically what it does is someone came up with this phenomenal technology a long time ago where they said, hey, what if we make a sharp tip that vibrates really fast and we put water on it? And what it does is it creates a layer of bubbles essentially that explode the plaque off of the teeth. So it's a really, really efficient way to get really hard buildup off of teeth, but also an efficient way to get in between those surfaces and actually clean more than our instruments can necessarily reach. So ultrasonic scalers, couldn't recommend them more. We use them for our prophies as well as our scaling and root planings, and they really, really make a tremendous difference in terms of helping patients get past their periodontal issues, maybe their sensitivity around teeth as well. This thing right here is called a air water syringe. So on the tip goes a kind of a white extension piece, but this has water and air. And the cool part is that you can squirt out the water or you can squirt out the air. It doesn't work as well when there isn't a tip that's directing the flow, but when you use them together, it creates a spray. So dentists, you might get this or you might get a spray, and it helps us basically clean up all of the extra tooth material, the gunk that comes off from the cavities. And it also helps us to clear out bad taste in patients' mouths. So in general, if a dentist doesn't know that something tastes bad, they're probably not a very good dentist, because everything in dentistry smells pretty bad, tastes pretty bad, and you hear a lot of terrible stuff too. So if your dentist is giving you anesthetic and it tastes bad and they aren't rinsing your mouth out, there's a very good chance they don't understand the patient experience very well. Here at Franklin Dental Care Dentures, we definitely do. So the other stuff here is, this is a high-speed suction. So like low-speed and high-speed handpieces, we have high-speed suction. So a big white tip goes onto this, and it suctions out the larger things. So for instance, if someone has a lot of buildup, then with plaque and calculus in their teeth, we don't want that going into the patient's mouth. So we'll attach this tip here, and this will create a lot more suction for the patient and make sure that all that gunk gets taken out of their mouth. Also for removing amalgam or for things that create some sort of burning in the mouth, getting rid of that smoke is also very, very important. So there's a high-speed suction. And then we have the low-speed suction. which is this little guy here. This is called a saliva ejector. And saliva ejectors have a more bendy tip that goes onto them. And this is used exactly for that. So a pro tip is if you're ever going to the dentist for the first time and you have a bunch of saliva and water in your mouth, you can actually wrap your lips around the straw-like piece and it'll get rid of everything in your mouth at once. This is just a really useful thing to maneuver in small areas and is used all of the time for dental procedures. So that's some of the stuff that's used for fillings and other things in dentistry. We're going to make some other videos about extraction instruments and other procedures that we do. This is informational and hopefully it reduces your anxiety in terms of knowing what a dentist does. This is Dr. Turab Rai from Franklin Dental Care and Dentures. Take care of yourself. I'll see you here. And if you have a chance, subscribe to our YouTube channel where you get a lot more information about your oral health and really hopefully have a feed that informs you a little bit more than distracts you. So take care of yourself. I'll be here.
Bye.